Welcome back to Plastic Surgery Untold, greatest podcast in the world, is voted by us. Today we're doing a very exciting topic that's hit some of the news, and as Dr. Arredondo's pointing out, probably a little bit new to the aesthetic world, not new to the world of medicine overall, but muscle toxin. So how we can use, some of the neuromodulators that we've used in the past, Botox, Dysport, Daxify, Jeuveau, Xeomin, all the good stuff, to basically kind of weaken, soften, control some of the muscles on our face. We can actually use throughout the body to shape and sculpt stuff. So super interesting. Some of the areas that we've been using it quite a bit are the trap muscles, the calves to give the legs a little bit slimmer appearance as part of the luxury legs. But maybe we'll let P.A. Gilbert get us started about what Muscle Tox and what all this hype is, and then we'll jump into some specifics and even some technology, maybe a little ultrasound talk, if you will.
So Muscle Tox uses the traditional neurotoxins that we're all familiar with for facial treatments to address other muscle groups away from the face or outside of the face. As you mentioned, the traps, the calves. And so what we are utilizing these neurotoxins for is to create a more aesthetic appearance by possibly slimming down these larger muscle groups for specific needs of a patient. And it has a really profound effect on how it works with these larger muscle groups, not only in an aesthetic perspective, but also sometimes help relieve some tension and stress, like in the traps. I think Dr. Franco has mentioned before in some previous social media posts how sometimes we hold a lot of tension in our shoulders, which can sometimes create different issues with headaches and such. And so relaxing those muscles can not only have an aesthetic effect, but also a therapeutic one.
I think a great example of that is something that we do all the time: masseter Botox.
Mm-hmm.
People do want that slimmer jawline sometimes to get a little bit more heart or oval shaped face, but it also helps people that grind their teeth a lot, and it's been a fantastic treatment. I know all of my friends in fellowship would sometimes just get that because of all the stress of being a resident. You're like, man, my teeth are wearing away. I need to chill out a little bit, and it helps so much.
Mm-hmm.
And so it has applications everywhere.
Hey, and Jenna, you recently did a Instagram post showing some of your calf injections with muscle toxin, which got a ton of comments and DMs. So maybe talk to us a little bit about why you treated somebody's calves and why that's become a thing.
Yeah, for sure. So everybody has different predominant muscles. For me, for example, my calves are an area that's always been larger. And for a lot of
check that out on YouTube if you'd like to.
For a lot of women, that can cause issues. They maybe just want a more slimmer appearance in that area, but also when you're buying, different boots and shoes and things, and you can't always fit into these really cute styles that you maybe want to wear.
I have that problem all the time. It's just these heels are
right.
You're wearing the skinny boots.
Exactly. So it can help with that, just give a really nice slim appearance. But what makes it super unique at our practice is we actually have an ultrasound device because the calf muscle is a pretty, thick area. So you want to make sure you're actually in the muscle when you're injecting that area, and that's what we can ensure with the ultrasound.
I think you touched on a couple points here that are super important. One, the ultrasound, sometimes we'll see people that have had toxins in these muscle groups and say it didn't work and so forth. But sometimes I think, without the technology of an ultrasound, sometimes it can be challenging to make sure that you're actually right in the muscle belly you're trying to treat. And like Dr. Arredondo said, it's not new to the world, new to the aesthetic realm a little bit, but one of my cousins is a PM&R doc, and they've been using ultrasound for targeted toxin to muscle groups for a long time, typically for medical reasons like spastic muscles, other things where you want to try and release and relax these. And so the idea of using this, has now become much more practical with some of these ultrasounds and these experiences. So actually super cool to see these muscles, see the muscle belly, make sure you're hitting exactly the spot you want, super safe, super precise.
Right. And, to talk about the safety a little bit, someone may say, okay, well, if you're paralyzing my calf muscles, does that mean my vertical is I'm going to lose my, my 8-inch vertical? And the answer is no. The calf's an area that's got a lot of redundancy. There's two heads to the calf muscle. There's a deeper one down below. I know in reconstruction all the time when I was doing my training, we would take part of that calf muscle and use it to help cover wounds. So you can sacrifice a lot of that muscle and not lose any function, even when we're taking a huge part of it. So the difference from toxin is really just more of that aesthetic look. It's not really a functional difference that you're going to notice.
Mm-hmm.
And a lot of that is very comparable, like you were talking about earlier, from the masseter muscle. You can still chew, you can still do that.
Right.
So we're not stopping that muscle from moving. All we're doing is softening it just a little bit so it's not so overactive and then shrinks over time. The other kind of cool thing that I've seen with muscle toxin in terms of masseter, traps, calf stuff is that, one, it does take a little bit of time to see the full effect. because that muscle needs to shrink down. But on the flip side, people tend to get much more time out of that treatment
Right.
than they would, facial. And some of it's probably just with the face, you can see any little movement right away. But the calves, it takes a while to build that muscle back up.
Right.
So some other pearls that you guys would like to talk to us about muscle toxic, because there's so many things we can talk about.
I think the again, to piggyback on what you're saying about the use of ultrasound technology. I mean, ultrasound has just taken off in the world of aesthetics, and it's just allowing us to basically have a set of eyes underneath the surface of the skin and really visualize what it is that we're trying to do. So I think that's huge.
The other part that, on the calf part stuff is most people who follow us on Instagram or social media stuff know that, the whole luxury legs and lower extremity is something that our practice is super passionate about. And it's really cool how this has evolved into this, because not only now can we, super snatch the waist, we can fill the butt, we can do some RF microneedling, some skinny sculpture stuff to help, kind of tighten the Ozempic butt, but we can kind of work all the way down so that, that whole body, when we're looking at it, goes and flows together, and it's really like a total body rejuvenation treatment package. And I think that's something that you guys have talked about in terms of treatment plans for them.
Yeah. And to kind of piggyback on some of the topics that we've talked about earlier with like the Ozempic butt and such, we've developed these different treatment plans for Ozempic body and Ozempic face. And, things such as, muscle toxin can very easily be incorporated into some of these other treatment options that we offer for patients that are going through a weight loss journey or have other, aesthetic concerns and needs.
Right. It's really a bespoke approach. We take each patient has a unique treatment plan. We address the concerns and the treatments and how we're going to get you to a good spot.
Can we talk a little bit about, I want to be real with patients, when each muscle group's going to be a little bit different in the amount of toxin that you need for each. Some of these muscles are a little bit larger, just like a master. Sometimes you're going to need a little bit more toxin to get the desired effect. Is that a fair statement?
I would say so.
And then going to vary a little bit from muscle to muscle group depending on the size of the muscle.
And maybe even patient to patient for that matter.
All right, great point. Because someone who has very, very well developed calves and strengths may need a little bit more. If somebody just needs a little subtle change to their trapezius muscle, then that may be it too. And that's where we can kind of have them flex and see what their aesthetic result is going to look like for them. I guess one of the other questions I have for you guys is, it almost sounds like it's a super complex procedure because we're using the ultrasound, a little bit larger volume toxin. Is that true or not really?
I mean, it's very similar to doing injections of the face. It's a very similar technique. It's just that you have this added safety net, so to speak, with the ultrasound to just really make sure that you are ensuring that you're in the right spot and targeting that muscle as best as you possibly can.
I would say probably the first few someone does, there's a bit of a learning curve just to make sure you're comfortable ergonomically, holding the ultrasound, finding the muscle, make sure you're targeting it right. But once you're good with it, you're good, and it doesn't add any time at all.
I will say too that the depth is different too, and so when we're using specific syringes for treatment of facial Botox, we're typically using a shorter needle for these muscle tox. We typically need a little bit of a longer needle, but the gauge is the same, so it's not going to feel any different.
And that's one of the things that I think is super important about the ultrasound. And I know we took some measurements the other day, but maybe we'll share these on the gram this coming week stuff, because I think sometimes people, especially in the calves where that fat thickness can be a little bit thicker than people think. And sometimes a typical needle that people use, especially if you use a TB syringe or one of these 32 gauges, may not be quite long enough to get into that muscle belly. And people may not be treating effectively. So it's not only safer, but making sure that if you are paying some money, and we understand that, this is important, you want, good value for your resources, that you're actually treating what you think you're treating. And I think that's super key.
Yeah.
But Jenna, you did a couple patients the other day, and it was actually pretty amazing how quick it is, because unlike facial Botox where you're treating a bunch of little, here you can actually hit it like Dr. Arredondo talked about, a couple specific muscle heads, body stuff there. It really doesn't take very many injections, and actually, a seasoned provider like you guys who use the ultrasound all the time, because we use it for a lot of different things in our office, actually is pretty quick and pretty seamless.
Absolutely. And I think that's what is an aspect of makes it semi quote unquote easier. I think there's a lot of art that goes into, the face in general and what exactly you want to lift. You can do a lot of really cool, neat things with neurotoxin in the face. You can do a lot of really, really neat things outside of that area too, but it's, you're focusing on a larger muscle and you're not doing as many injection points. So it is a little bit quicker for patients, which is nice because, if it is a longer needle, you want to make sure it's as painless as possible.
And definitely, a little bit of a different feel because you are penetrating a little bit bigger muscle. But I mean, one or two, quick injection stuff. It's pretty quick in terms of that. And then I was actually pleasantly surprised. We did my girlfriend's calves a couple of weeks ago, and she lives out of town, and have already seen a difference in it, which is absolutely amazing, and something that maybe we underestimate, but especially here in June in the summer where a lot of people are wearing shorts and other stuff. I mean, for a lot of people, and I don't think maybe I appreciate it as much of how concerning some of those things are to people, especially when you work out really hard. And sometimes when you're working out really hard to make the rest of your body feel fit, but certain muscles just tend to overdevelop, how concerning that can be. And it's made such a big difference. And she's probably brought it up so many times. And it's super exciting when people are so happy with the treatment.
Absolutely. Something else that I'm really excited to see, because for me, my traps are definitely an area that overdevelop even from middle school. My mom took me to the doctor because she thought something was wrong with me. And they were like, her backpack's too heavy. She's fine. But I feel like we all are so used to looking down at computers and screens. And so these muscles just do get overdeveloped. So I'm really interested to see how that helps with overall posture and things, because I know this area pulls a ton for me. And once that's able to relax, it's just, in theory, it would be so much easier to kind of really have appropriate posture, get rid of that tension, and have a slimmer effect here too.
I mean, on that note, I have lost my ability to know when she's upset with me, though, because when she gets mad, those shoulders go up so quick, and I can tell, by the level of elevation, the level of trouble I'm in. So, that key is off. So, that's the one downside to it.
Yeah, the one negative.
Gilbert, any other last Muscle Tox nuggets you'd like to share with us?
Not necessarily Muscle Tox, but maybe something that I could just add,
Sure.
because it is in the realm of toxin, and we've talked about it before, and you kind of alluded to the hot Texas summers is hyperhidrosis.
Ooh.
So excessive sweating, and we can use neurotoxin to essentially just slow down or even stop excessive sweating in certain areas for patients, particularly underarms. I've treated a patient's scalp before just because they just had, excessive sweating of the scalp that, was constantly getting in their eyes. And it's a really quick and easy procedure. But more importantly, it is game changing for these patients because they suffer in silence for the most part,
I don't want to spoil, a future podcast or maybe a future something coming to the practice relatively soon, but there may or may not have been a new product that just got FDA approved in April to help with hyperhidrosis. That's an in-office procedure, super painless, that treats it for about 3 to 4 months. So I'm going to leave you guys with that nugget on that topic of something coming soon to likely to our practice and to APS and to a podcast, but something super exciting that have been discussions with this past weekend. So some cool things on the horizon, because as you guys know, we want to bring you the latest and greatest of proven treatments all the time. Last question I have is, do you guys have a favorite toxin for your Muscle Tox?
I don't personally have one. Jenna?
I think it truly just depends on the patient, just like, toxin in any other area. For some patients, they feel like one works longer, better for them. And so it's just finding out, trying different ones and seeing which one affects them the most. But I personally don't have a set favorite either.
I think it'd be important to kind of take into consideration the different properties and characteristics of each muscle neurotoxin when you're making your decision. But yeah, I don't have one in particular that just stands out in my mind.
Dr. Arredondo, feel strongly about one versus the other?
No, I think I'm siding right with them. Like, just some patients think one works better for them than others, and so I try to stick with what works for them.
Awesome. Well, I think this is super exciting. Definitely more things we're going to share about this, because I think this is a whole new frontier, and definitely is we've really tried to be a leader in this whole luxury legs concept. I think there's no way to talk about luxury legs and not go all the way down to the ankles and feet, and so don't want to spread some more, ruin some more spoilers. We've got some more feet stuff coming up soon, so lots of things. Plastic Surgery Untold, greatest podcast in the world, is voted by us. We'll talk to you guys soon. See ya. Bye.
Bye.